Now, from Wish TV, your local news source, this is All Indiana Politics.
Good morning and welcome to another edition of All Indiana Politics on this Sunday. We now know one of the first things lawmakers will tackle in January is the bill to essentially ban Indiana companies from requiring COVID-19 vaccinations for its workers. GOP lawmakers have revived the bill, even giving it a number, House Bill 1001. The number is usually given to the top priority for this session. The bill would prohibit any government entity from imposing a mandate that would include Indiana University. It would require businesses to honor any request for a medical and religious exemption and make businesses pay any cost of mandatory employee testing. Let's welcome in State Representative Republican Mike Speedy. Mr. Speedy, good to see you. Thank you for joining us today.
Good to see you as well, sir.
So you're the author of this bill. Why do you think that this bill is needed right now here in Indiana?
Because we're listening to our constituents and they're concerned about losing their jobs. They don't have the confidence in the process that has gone through to generate these vaccines against COVID-19, and they're not ready to sign up, take the risks to have the jab, so to speak. So I'm trying to lend them a voice, to be a co-author in 1001 to help them out, to give them medical freedom.
Right. So to be clear, though, the bill pushes for COVID testing to be paid for by the employer. What do you say to small business out there who says this is going to get pretty pricey?
Well, you're correct. It's not an outright ban on the mandate. It gives the employer the option that should they decide to impose the mandate with it for their employees, that they do have the option of offering testing and paying for that. They don't have to give a vaccine mandate. A lot of businesses are simply responding to the federal government's heavy-handedness and really don't want to be caught in the middle. So I don't think it's a burden at all for business because they don't have to offer a mandate to their employees.
So as you very well know, the Chamber of Commerce and many members of the medical community came out just a couple of weeks ago and said, hey, this isn't the right time for this. Your response to them?
We are constantly having to balance the interests of business to the individual freedoms of each of their employees. I think 1001, though, will be probably changed and amended, strikes that balance between letting the business decide whether to offer a mandate. Obviously, they're being pressured to at this point, and they may have to if the federal government has its way. But I think it balances the medical freedoms and rights of their employees with that of business.
Do you think you could get the medical community and the Chamber of Commerce on the same page with you and get this thing passed?
That remains to be seen. I think it's possible, but if it doesn't, it's important that we stand up for our constituents who are under threat of losing their livelihood, especially around holiday time, as if it couldn't be any more stressful.
Do you think that this bill maybe goes against what we've heard from as far as the state goes in trying to get everybody vaccinated? I mean, that's been their push for quite some time. Does this bill work against that?
I don't think so. I think education is the secret to getting people vaccinated, and each person has to decide what their risks are for taking the vaccine. It's not a one-size-fits-all. I understand why some people do not want to get vaccinated for either medical or religious reasons. And I understand why it would be good for others, given their age or other pre-existing conditions or morbidities, would want to. So it preserves freedom and educates at the same time. So I think it's a good bill.
Do you have the votes right now to get it passed?
I believe we do in our chamber, without a doubt.
Are you sure?
I am confident.
Okay. Fair enough. In your opinion, is Indiana doing enough to stop the spread of the virus?
I think they're doing everything that can be reasonably done for government to stop to control the virus, and I think to do more would be too much. Some would say they've done enough. So in general, I think the public is pretty satisfied with the level that's come forward.
Before we let you go, where does it go from here? What's the next step?
Well, if it's not heard later this month or decided in this chamber, which is looking like it won't be, It'll be the highest priority in the House of Representatives and be dealt with the first week we convene in January. From there, it's up to the Senate to do what they have to do.
We'll see what
But
happens.
it'll be the highest priority in our chamber.
Okay. We'll keep an eye on it. Republican State Representative Mike Speedy, thank you for joining us today, sir.
Gladly.
Talk soon.
Yeah, Mr. Britt.
All right, coming up, we'll talk to a leading Democrat lawmaker about the bill to block vaccine mandates. That's next on All Indiana Politics. And let's welcome in Democrat State Senator Fadi Cadora. State Senator, always good to see you. Thank you for joining us today.
It's a pleasure being with you. Thank you.
Sure, good to talk to you again. So, Senator, as you very well know, Republicans say they will revive the bill that essentially bans employer-based vaccine mandates in Indiana. Democrats have blasted it. How do you feel?
I think it's bad public policy. I think it's more about politics than policy. It's an unfunded state mandate that is bad for businesses and bad for employees. The Biden administration already paid for testing, so I don't see why this bill requires businesses in Indiana to pay for testing. I think it helps spreading misinformation about the vaccines at a time when we're trying to rebuild our economy and connect Hoosiers with jobs. So I don't think that it's a good piece of legislation. I don't see why it's needed in Indiana. I think businesses know their interests better than anybody else. Small and large businesses in Indiana said it very clearly. We are responsible. We're going to try to take care of ourselves. You know, there are different sizes of companies in Indiana. What might apply for a small company is different than what might apply to a large corporation. So the Indiana business community's position on this has been, you know, let us do what is right. We know what is best for our businesses. My concern with this legislation specifically, that it is an unfunded state mandate that requires businesses to pay for testing at a time when testing is available through federal funding. So I think it's just really more about political posturing rather than solving an actual problem.
Do you think that the state government's doing enough to protect Hoosiers and businesses from furthering the COVID-19 variant and virus?
I think we can do much better. I appreciate the work that has been done, especially by the Indiana State Department of Public Health. I appreciate the work that has been done by all of our healthcare workers across the state of Indiana. But we heard very clearly, very loudly from healthcare professionals who testified last week against the House bill or the ideas that we see currently incorporated in House Bill 1001. Healthcare professionals said clearly, we are tired, we're exhausted, and we have so many patients coming in, their hospitals, their emergency rooms that just refuse to get vaccinated. And that basically is impacting lives across the state of Indiana. We're losing Hoosiers, we're losing young children, we're losing senior citizens. So we can do much better as a state.
Would you support reimposing mask mandates?
I think here in Indiana, we are at a point where we allowed local counties to assess using data what is more viable for their communities. So that decision has been left to the local departments of public health to assess on a county by county basis. And I would be supportive of that county by county solution. I don't think we are back at the stage of imposing statewide mask mandates, but and I wish that we will never get to that point. Hopefully that we move in the right direction if we continue to invest in vaccines, testing, and doing what is right to protect all Hoosiers across the state.
What do you say to folks who say, hey, this is the new norm. This is something that's going to be here forever. We have to learn to live with it. And we can't vaccinate ourselves out of it. We can't mask mandate ourselves out of it. We have to live with the virus, similar to what we do with the flu every year. Your response to those who say that?
Throughout the history of humanity, we have seen that when we've used scientific methods to deal with illnesses or pandemics, that we have made more progress when we followed science and when we used data. That has been part of the human history. And with the testimony of most experts globally, not only in the United States, vaccines do work. And it's not a political issue. It's not a Republican versus a Democrat issue. the ISDH, the governor's office, the president, the former president, and others pushed for vaccines because it's the right solution. And I think that we have to follow science. We have to be sure that we allow for exemptions based on federal law. So federal law allows for exemptions based on medical reasons or religious reasons. House Bill 1001 that was introduced by the supermajority doesn't change anything based on federal law. It's already in federal law that you have exemptions for medical or religious reasons. So I think it's more about politics and sending the wrong message about vaccines at a time when we need to be ensured that we are expanding access to vaccines and testing in Indiana. We currently rank in the bottom 10 states across the United States in terms of the vaccine rates. So we should be sending more positive messages about the role of vaccines in helping and protecting the life of all Hoosiers across the state.
One more question before I let you go. Do you support part of the bill that allows the governor to end the public health emergency?
I do. I don't have a problem with ending the public health emergency as long as we are empowering ISDH, the Indiana State Department of Public Health, and the Family and Social Services Administration, and other critical state agencies to declare their own emergencies so that we can benefit from matching federal dollars and getting the higher reimbursement rates under COVID-19 laws. So I think as long as we have the proper exemptions in the law to empower state agencies and local units of government to function, then I'm okay with that.
Fair enough. State Senator Fatty Cadora, thank you so much for taking some time as always. We'll talk soon.
I appreciate you.
And coming up, our political experts talk the vaccine mandate and the Supreme Court hearing that could overturn Roe versus Wade. That's next on All Indiana Politics. And welcome back to All Indiana Politics on this Sunday as we welcome back Democrat Laura Beck, and welcome to the show for the first time Mario Masalamani, an attorney and Republican consultant. Good to see you both. Mario, we'll start with you here on this Sunday. In your opinion, is it trouble for Republicans to make this issue number one for them? As you know, not every GOP lawmaker or even Governor Eric Holcomb are on board, and business leaders are also against it, a lot of them.
The biggest problem for Republicans is that the Republican voter wants this bill passed. They believe that we need to codify the federal regulations regarding mandates, and they want to have at least a religious exception and a medical exception. And right now, the federal law is such that it's very difficult to determine what is a religious exception, what is a medical exception. And this bill clearly defines what each is and the process in which it is done, so that way you can get that exception.
Laura, I'll let you respond.
Well, I think it's first of all, welcome to Mario. It's nice to have him on here. Yeah, it's nice to have him with us. I think that one of the big challenges with this bill is that it's frankly coming at the wrong time. Indiana is 40th in the nation in terms of citizens who are fully vaxxed. That's 40th in the nation right now. And when you start thinking about how we've got this variant that is floating out there that we're learning more and more about every single day, what science is telling us is one of the best ways for us to get out of this pandemic is to make sure we're getting people vaccinated. I think we all can understand that some folks are going to have a medical reason, some folks may have a religious reason why they don't want to. But what this bill does is it essentially takes away from Indiana being one of the most pro-business friendly states in the nation by putting these type of restrictions on businesses when they know what they need to do for their employers. And they know it makes sense for them for business purposes. So to put something out there like this at this point in time when our cases just continue to go up. In fact, this past week, we've had 3 straight days over 5,000 cases. Right. This just isn't the right time to do this.
So Mario, in your opinion, is this anti-business?
I don't think so. I think that what this is pro-Hoosier. And because myself included, when I went to go get the Pfizer vaccine, I was actually turned away the first time because I have an allergy to shellfish. And so I have gone into anaphylactic shock before and had to have an EpiPen. And so with the help of my doctor and talking to the providers, I have been fully vaccinated, but there are certain people that have a medical exception that taking this vaccine or the booster can potentially cause significant medical issues from conditions that they currently suffer. And so I think that this is a pro-Hoosier bill, that it allows Hoosiers that have a religious exception or a medical exception to be able to still work. Because right now, businesses need employees to work. And one thing that I'm hearing from so many small businesses is that we don't have employees. And if this mandate forces me to fire some of my employees because they're not vaccinated, because they have a medical condition, I don't think that's appropriate. So this is a pro-Hoosier, pro-business bill that allows businesses to take the exception for medical or for health, and to still allow this person to stay employed. It allows our small businesses to keep our employees and keep churning.
Well, Phil, I want to make sure, though, I'm sorry to interrupt everyone here. This is your show. But I think, though, that we're getting really focused and going into the vaccine piece of it. But there's a testing component as well. So if you do have a medical reason why you don't feel like, if you do have an allergy or a reason why you can't have a vaccine, you can get tested once a week.
Right.
And frankly, most of us are getting tested because most of us, every time our kid has a sniffle, has to test our child before they go back to school, if you do have children. So I think that the testing component is a really important component of that. It is not onerous for people to have to take a test once a week when hopefully they're testing themselves regularly as it is. And so I think we can, let's stay away from just being about the vaccine and look at it from the testing component, because we know the testing component is what makes it successful in a lot of other countries and how they're fighting it.
I have about 3 minutes left. I want to get you both on this next topic. We'll switch it up a little bit here. This week's Supreme Court hearing, you both know this one, on the Mississippi abortion law. It appears the justices are willing to uphold the law and maybe willing to also overturn Roe. Laura, is it dangerous for Democrats to maybe put too much focus on this issue for 2022 in regards to the elections? Most of the polls point to the economy as the number one factor for voters.
Yeah, I do think the economy is definitely going to be one. I think from just kind of stepping back a little bit, rather than saying it's dangerous, I think we have to also be really mindful that this is going to become an election year. No doubt about it. This is going to be defining the midterms, assuming we don't have something else happen, which possibly could. But I think a lot of folks are going to really use this as a political driver, particularly on the Republican side, to really try and get their base out this cycle. That with these vaccine mandates, I think they're going to do quite a bit of it. If Roe is overturned, which I fully expect it will likely be, I think we can see Indiana be one of the states immediately to move in that direction as well. And frankly, I think it's an opportunity for Indiana to really put its money where its mouth is in terms of being a pro-life state, and start investing in maternal mortality, start investing in child development and those type of activities, so we can really actually lift families up rather than tear them down. Mario,
I'll get you in here. Does this define 2022 in your opinion?
I don't think so, not at all. What's interesting and almost nerding out is the fact that conservative justices are debating right now if it's going to be overturned or if Roe v. Wade is going to be limited to 15 weeks. And I think it's a fascinating issue, but it's not going to be an issue that's going to impact 2022. The one main thing that's going to impact 2022 is the economy. We saw that in Virginia. There was some polling done after the governor's race that showed that the economy was the number one issue that between Democrats, Independents, Republicans. So Republicans aren't going to honestly be talking too much about the vaccine mandates or the mask mandates or Roe v. Wade. We're going to talk about the economy, how gas prices have gone up, food prices have gone up, cost of services have gone up, and that Hoosiers, Americans in general, can't afford the runaway spending and the runaway inflation that's impacting our country. So I don't believe that Roe v. Wade is going to be big of a decision in 2022, but I do think that it's important to understand that the conservatives right now are battling as to if they're going to overturn Roe v. Wade or if they're going to limit it to a 15-week abortion period.
All right, we'll leave it there. Good conversation, Laura, Mario. Always good to see you both. Thank you very much. We'll talk to you soon, and we'll be right back.
Thanks, man.
Take all Indiana politics on the go with you. Download our podcast now. part of the All Indiana Podcast Network and allindianapodcastnetwork.com.
All right, thank you for joining us for All Indiana Politics on this Sunday. We'll be back here next Sunday morning at 9:30. You can also find our brand new All Indiana Politics podcast. It's part of the All Indiana Podcast Network at wishtv.com. Have a great rest of your weekend.